By understanding the effects of lupus, I hope that people will understand the importance of its awareness. Have you ever heard of lupus, or do you know what it means to be living with lupus? It's been around since the 12th century and the public generally knows nothing about it. It is a chronic inflammatory disease that has a survival rate of less than 50% if untreated and 95% if treated. It is vital for society to know about this disease, lupus. The frustration of being sick, coupled with the isolation and not knowing why, is unnecessary, especially in this day of mass communication. I'd have never believed a person could go from being otherwise healthy one day to sick and crippled the next, if I had not have personally experienced it myself. Today we will be covering what exactly lupus is, how to recognize the symptoms, and how to learn to live with it. As we try to recall what we do know about this disease, we may realize that we don't know much. There are 4 kinds: drug-induced, discoid, systemic, and neonatal. Systemic, meaning more than one body system, is the most common form and is usually the lupus, or the form of lupus that people refer to when they say that they have lupus. It mainly affects skin, joints, blood, kidneys, and is a connective tissue disorder, which means that it affects basically any tissue within the body. The healthy immune system usually produces antibodies to protect the body from foreign invaders such as flu germs or cold germs. The lupus immune system, otherwise known as an autoimmune system, meaning self, auto meaning self, mistakes the body's healthy tissues or healthy cells for foreign invaders such as the germs, and attacks healthy tissues and damages otherwise healthy tissues. At least 1.5 million Americans and 5 million people worldwide suffer from lupus, 90% of those being women. Ages affected are usually 14 to 44 birthing years. Although there are no major studies recorded on lupus, it is known that it does primarily affect the working class at an average cost of $20,000 a year. That's $1,700 a month, $427 a week, at $61 on average a day on a working class budget. Based on the Center for Disease Control Economic Impact Report in 2007, medical costs for treatment were over $12,000 a year for a lupus patient. The average loss of income for a lupus patient was over $8,000. Based on those figures, the loss of income that I would have lost in the last 4 years that I haven't been able to work is over $34,000. Logistically, based on the $25,000 I made a year, I would probably have lost $100,000, not including medical costs and debt that I have acquired due to the treatment that was necessary to treat it. Dr. Bruce Baggy, he is a rheumatologist specializing in lupus at Scott and White Hospital in Temple. He best explained to me that living with lupus was more a quality of life issue, meaning that we take as much of the good and use that to compensate for the bad. We make as much as we can out of the good days and the healthy parts of the body to compensate for the bad parts and the bad days that we have. To receive treatment, we do have to know how to recognize lupus, the symptoms that are caused by this disease. It is known as the great imitator because it mimics so many other different illnesses. Usually the symptoms vary by different body systems, and it's mistakenly diagnosed as an illness more specific to that body system. It is mistaken for diseases such as rheumatoid arthritis, blood disorders, diabetes, heart, lung, muscle diseases. In the year leading up to my diagnosis, I had been treated for internal internal bleeding, herniated disc, depression, sun allergies. I was then, after a year of emergency room visits, hospitalizations, different specialists, medical professionals, I was diagnosed with discoid and systemic lupus. Discoid affects the skin. It does cause scarring, but it is not life-threatening as systemic lupus is. Common symptoms include extreme fatigue, headaches, pain, swollen joints, muscle aches, pains, fever, anemia, which anemia is low blood cell count, edema, which is swelling, butterfly rash across the face. The R&B singer Seal has a scar, a butterfly rash scar, also known as a malar rash. Photosensitivity, which is sensitivity to the sun, hair loss, circulatory problems, and I have personally experienced every one of these except for the butterfly rash. I do have scars on other parts of my body from the discoid or from the lupus rash, and it is usually treated with a round of topical steroids. Usually an outside manifestation often are signs for an internal flare. If you have a rash, then there may be that may be a sign that something's going on the inside with your organs. It is important to maintain regular lab testing. Inside manifestations may include swelling in the kidneys or the lining around the kidneys, the lungs, the heart, brain, nervous system, the blood vessels, hardening of the blood vessels due to the swelling. And I've experienced all of those as well, except for the hardening of the arteries, although that is the cause of death that my mother was listed with at the age of 47. Unexpected death, no symptoms whatsoever, and also no diagnosis of lupus. More than 90% of lupus patients will suffer with joint and muscle pain, 40% with kidney complications. Other body systems affected in combination or individually would be heart and circulatory, digestive, muscle, joint, bones, kidney, oral cells, blood, arteries, blood vessels, and it is treated symptomatically, which means it is treated as needed specifically to the symptom. So there are sometimes more than one medical professional required to treat the disease, which leaves room for error when being prescribed medication. So always check all your medications over the counter or prescribed, like on drugs.com for medical interactions or fatal interactions, any dangerous interactions, because sometimes the doctors do overlook it, and that can be expected. They treat a lot of people. At the time of my diagnosis, I was treated with 7 different prescriptions, 3 of which I could not operate a vehicle under the influence of, 2 of which were chemically and physically dependent, or could cause chemical and physical dependence. Now that I have control, or we are able to manage my lupus, I don't want to say control, jinx myself. I take 1 to 2 medications. I take one always, my anti-malarial Plaquenil. I take that daily. That helps maintain the lupus, and then as needed, I take a pain medicine. Also, I guess now that you're aware of some of the dangers of lupus, let's consider the options that are available for treatment. There is no known cause, so there is no known cure. Only one medicine has been approved by the FDA in the last 50 years for lupus. A lot of the medicines that are used to treat lupus are not FDA approved, so therefore insurance will not cover them, and that is a straight out-of-pocket cost for an already suffering, out-of-work patient, lupus patient. And with all of this, we still live in a society that doesn't know anything almost about this disease. Our only defense is a proactive effort to educate ourselves, our family, and our friends, the general public, to hold lawmakers responsible, and for funding research to begin profiling this disease and try to better understand, document and better understand the effects of lupus and how it has survived for so long. There are no specific diagnostics tests because its symptoms so closely mimic other diseases. The American College of Rheumatology came up with a checklist of 11 basic symptoms. A candidate for lupus will meet 4 of the 11 in combination with the consideration of your lab test results, medical history, and immediate family medical history. Usually when lupus begins to manifest, it does mimic other diseases that your family's medical history may have had. Once diagnosed, a case-specific treatment will be developed for you individually to treat your case, and that will help offset any current ailments that you may